Amiodarone, lidocaine, or placebo in out of hospital cardiac arrest. Cardiac arrest is the abrupt loss of heart function in a person who may or may not have diagnosed heart disease.
Sudden cardiac arrest is a leading cause of death. A lot of victims have no warning symptoms. It just happens. A person collapses, suddenly unconscious and no longer breathing. And it can happen anywhere, at work, at home, or anywhere else. So, what is sudden cardiac arrest? Sudden cardiac arrest means that the heart's electrical system starts misfiring in a chaotic, useless rhythm called ventricular fibrillation. The victim's heart suddenly stops pumping blood. It just quivers. Almost immediately, they lose consciousness and they stop breathing. Now you have to act quickly for the best chance to save them. The longer they stay in this condition, the lower the chances are that they can be revived. The only way to stop ventricular fibrillation is with a controlled shock to cause the heart to restart in a regular rhythm. That's called defibrillation. Defibrillation is most likely to succeed if the patient is shocked within about the first 4 minutes after collapse. Here's why. When the heart stops pumping blood, the heart, brain, and other vital organs stop getting the oxygen they need. The odds of restarting the heart are going down about 10% every minute. That's why CPR and having an AED is so important. When you call 911, the emergency medical team will get there quickly, but it still takes an average of 6 to 12 minutes for them to arrive.
Now, amiodarone. Amiodarone is an antiarrhythmic medication used to treat ventricular tachycardia or ventricular fibrillation. On the other hand, we have lidocaine. Lidocaine controls abnormal contractions of the two lower chambers of the heart, particularly after a heart attack. Placebo, Saline's placebo. A placebo is a simulate or otherwise medical ineffectual treatment for a disease or another medical condition intended to deceive the recipient. Amiodarone, the uses. Now we have the advantage of the amiodarone and lidocaine. We have minimal negative inotropic effect, can be used in breathing disorders. And the risk of amiodarone and lidocaine, we have wheezing, coughing up blood, chest pain, breathing problems that get worse, a new or worsening irregular heartbeat, shaking, and also convulsions. The use of lidocaine in medicine. It is used to spinal analgesia, ventricular fibrillation, and also ventricular tachycardia. Amiodarone in medicine. It is used to atrial fibrillations and flutter maintaining sinus rhythm, ventricular fibrillation,
amiodarone or cortisone. Classification: antiarrhythmic or a class 3. Action: it acts directly on the myocardium to delay repolarization and increase the duration of the action potential. Basically, it's trying to slow things down from a ventricular standpoint. Indications: ventricular dysrhythmias, second-line agent for atrial dysrhythmias. Adverse effects: patient may complain of a burning sensation at the IV site. They could have hypotension and bradycardia. Contraindications to using amiodarone: a patient with sick sinus syndrome, basically a slow heart rate, any second or third degree heart blocks, cardiogenic shock, when episodes of bradycardia have caused syncope, and any sensitivity to benzoyl alcohol and iodine. Dosage: ventricular fibrillation and pulsus ventricular tachycardia. The adult patient will receive a 300 milligram bolus IV or IO. It may be followed by a one dose of 150 milligrams in 3 to 5 minutes. After converting your patient, follow with a 1 milligram per minute infusion for 6 hours, then a 0.5 milligram per minute maintenance infusion over 18 hours. Pediatric patients should get 5 milligrams per kilogram for a max dose of 300 milligrams, and you may repeat 5 milligrams per kilogram IV or IO up to 15 milligrams per kilogram. Relatively stable patients with arrhythmias, such as PVCs or wide complex tachycardias with a strong pulse. Adult patients should get a 150 milligram and 100 mLs of D5W IV or IO over a 10-minute period. You may repeat in 10 minutes up to a maximum dose of 2.2 grams over 24 hours. Pediatric patients should receive 5 milligrams per kilogram very slow IV or IO over 20 to 60 minutes, and you may repeat in 5 milligram per kilogram doses up to 15 milligrams per kilogram for a maximum dose of 300 milligrams. Special consideration: this is a pregnancy class D.
Now we have the conclusion. I think that the advantage or benefits of this drug in cardiac arrest is minimal. In the industry of pharmacology, there are other drugs that can drop a better result in this kind of pathology. Thank you.